we know that we are going to discuss a little bit about the psychiatry, and I will focus on my part, which is uh, based on our survey finding, which I will be enumerating and highlighting that this is one of the recent survey, basically in 2024. So this is something which is give insight to us, despite so much research and emphasis on psychiatry. What is the current status of psychiatry training among the PG resident and the early career psychiatrist, and the reflection of the training they received. So I will be just focusing on that, and then there will be other part of the psychotherapy training we will be discussing. So we know that these things already is there in the textbooks, but I will not be skipping this slide. I will be skipping this slide. So these are not required, but we know that there over the period the number of therapies has been evolved. Okay, around 450 therapies are there which are evidence based, and there are lots of other names are there. So we get confused, and our even we are confused, and the trainings are also confused. So we'll go ahead and just move to the basic finding of the therapies. So we have contemporarily have this classification of therapy which is given in the most of the textbooks, and we ask questions and focus on these therapies, so that whether these therapies and their trainings are available in the institutions across the India. And the survey so if we look at some of the researches on the therapies, so we find that from the last few years, like this 2010 to 23, although lots of research has increased. So it gives an idea that many people, although the number of psychiatrists has increased, faculty has increased, institution has increased, that may be the reason that the overall number of the researches which is done on the psychotherapy, it must have increased. But it gives that there is definitely people have this perception that this is very important part and we should be doing lots of researches, and that's what we have to give little more emphasis. So when I conducted this kind of a survey, which was mostly electronic based survey done on the most of the members of Indian psychiatrist societies and government and private institutions, we found that despite there are lots of emphasis, and most of the majority of the institution has psychotherapy in their curriculum, but the structure of the therapy training was not there. So which is reflected by this research. If we look at the mental health institutions, those are different in the sense of available resources, and there are other institutions which is like GHPUs, General Hospital Psychiatry Units. Among them also we have distribution. Some of them are from the INIs and some of them are not controlled by NMCs. NMCs has their curriculum, so there is some basic structure, but INIs have their autonomy. So again, there is a little bit of variations among the institutions. So those things are there. The idea of the first finding of the research is that uniformity across the institutions is lacking. So therapies, despite their curriculum and all that emphasis, the uniformity across the psychotherapy training is something which is observed in the study, which is also in the agreement of the other research by other people. What other thing is that we found out that we usually focus on the MD respondent was quite high, perhaps because the MD course is there and they perhaps participate in our research. So, and the response from the GHPUs. We know that now there is no mental health institutions in the last few 20 or 50 years, like no addition. The GHPUs is increasing. So the main training center becomes GHPUs for the MD courses. So those were the main responses we got, and we found that there is a very poor structure of psychotherapy and inconsistency across the country. So we are clear with this responses, their discrepancies. These are some of the questions. For example, if you see that rate your exposure to psychotherapy based on the hours. If we do see that how many hours of a psychotherapy training is dedicated, then we find these variations. Okay, here the responses are broken down into very good and average and all that. So we find that there is a variations. So how often do you patient? This is we ask from the this is the perceived need for using psychotherapy in clinical practice. For example, if you ask, this domain we have asked from the practitioners. So if they practice, that how they feel that their patient is demanding therapy. So these were the responses. A great number of majority of the practitioners felt that there is a demand by the patient, but we cannot fulfill because there are various reasons. Either we do not have time, or we are not feel confident, or we are not feel qualified to perform it. As Nitasha said that okay, this is something notion that okay, this is not our domain and better to refer to a psychologist or something, or a therapist. So this kind of situation is there, but no doubt a high perceived need has been observed in this reflection of 2024. This is we almost covered all the state of India. Okay, so those things are there. It's a reflection of Indian survey. It's that's why it's a national survey. So what we problem statement is that okay, there's a need for training of therapy, but there is a limited training opportunity, dearth of well-trained supervisors. Training need to integrate with the UG and PG curriculum, and the Western psychotherapy model is less fit into the Indian model, and culture sensitivity and integration solution is required, and behavioral therapy and the system-based approach work better in India. So that was some of the problem statement we found.
You have 1 minute.
Is it the next part of the? Yeah. So next, Dr. Murali will be taking over from this.
I like.
Okay, sorry, Dr. Kishor will be taking over from this.
Thanks for sticking to time.
So, good afternoon everyone, and respects to the chairpersons. We are really delighted that you thought of coming here, and once we know that there is a need for psychotherapy, we have to think what should be done. I'm also the chairperson of the IPS PG Education Subcommittee, and we really thought about what can be done because there was so much of information available that there's a great need, and we did another survey. What is that they want? So one of the things which came out was majority want at least 12 sessions of supervised training. So that is the next level of our understanding about how to tailor to the need. It is not just we know that they are interested, what should be done was another thought which came to us. So what we did was we floated the IToP psychotherapy platform. It is an online platform. We made Google groups. Dr. Ajay is heading that Google groups, and we have WhatsApp group. We had a workshop in Bhopal in 2025 on psychotherapy. We also had done a workshop in the 2024 IToP National Conference in St. John's, and we identified some faculty who are very good. For example, Professor Matthew Verghese from NIMHANS. He has trained for nearly 40 years psychiatry postgraduates in psychotherapy. But we knew that there are very limited number of psychiatry faculty who can do that supervision. So we started in a very big way. We asked Dr. B.N. Gangadhar, we initiated experts, and we started free session. Surprisingly, free sessions were problematic. We did it on Tuesdays. There were no active members. The numbers which started with 60, they dropped down, and nobody was keen to present on the thing. And we felt that small group should be there where there is deep reflection, better insight, and learning. So, that is in regard we floated this IToP SPSS program, which is psychotherapy supervised sessions, and we pulled in two faculty, Professor Matthew Verghese, who delivered it online, Professor Raghuram delivered offline, and the candidates had to apply. They were selected by interview, and we picked up because we should know the dedication of the faculty who are keen. So we have 6 in each group now. They are being trained for last 6 months, and Dr. Nitisha is here. She will tell more. We also have another batch under Professor Matthew Verghese, one for faculty and one for SR. And now new team under Professor Pratap Sharan is going to start, and the applications are still open. People interested can apply if they want thing under the supervision. So what is this we did was we had this enhanced supervisors. We want to see those who are interested offline should have offline thing. Those who are interested in online, they should have. We also are keen to build a collaboration with UK. We have discussed with Dr. Arun Kishor from UK. The Royal College is keen. So in the next 5 years, we want to see at least 200 faculty across India. Out of 6,000 faculty we have, at least 200 should be trained in psychotherapy training. So we partnered with the NGOs, we worked toward a collaboration, and very luckily we had a funder who said that he is going to give award for any young faculty who is doing some work to train the postgraduates in psychotherapy. So it is called IToP Samvad Award. The details have already been out, but it is open till end of March. If any faculty in any institution is doing some work, they can do it forward. So this is what we have tried from the survey to implementation. It is a long journey, but we are on the road. In the 3-4 months, we also did a workshop with the all editors of India. It is available in the YouTube channel. What psychotherapy research is required, what kind of training is required in publication and research was also discussed with Dr. Pratima Murthy of NIMHANS, Dr. B.N. Gangadhar, and many people. So that is also available, and we came out with a consensus document on how much psychotherapy training should be given. It is there in press and media. We said 60 to 100 hours in the training of the postgraduates in DPM, MD, DNB should be at least this much. And wherever there are no faculty, we should have faculty from outside who can pitch in and support. That's what we have recommended in the thing. It is easily available for anybody's opinion. So with this I conclude, and I request Dr. Nitisha, who has started to, Murali, to give us insight into who are these people who were keen to be part of psychotherapy training, and what is that we found from their approach. Over to Dr. Murali.
Thank you, sir. Good afternoon, everyone. So, sir already said that we have done a survey that more than 600 psychiatrists wanted to participate in psychotherapy program, and because they wanted to train in that, but we don't have a platform for that. In England, we have something called IAPT, Road Access to Psychotherapy. Now it is called as NHS Talking Therapy model, where they'll be trained, supervised, and in the end, after the session, they will be assessed also. And the workforce also divided. But in India, we don't have that much of platform to train the psychiatrists for that aspects. So IToPs has launched a new program that is a scholarship for the psychotherapy supervised session. It is launched in the 2025. It has both the online and the offline programs. It's for training of both the trainers as well as the early career psychiatrists, that is the professors as well as senior residents. It provides structured and supervised sessions at the consistent intervals, once in 2 weeks. It's mainly focused on psychodynamic, supportive, and eclectic therapy. and it is supervised by the Dr. Matthew Verghese sir. That is online sessions, and offline session were supervised by the Dr. Raghuram sir. So IToP IPS, they've wanted to start the psychotherapy platform that IToP SPSS. People have interviewed and selected. Now 5 faculty under Professor Matthew Verghese sir is trained, 6 under Professor Raghuram, that is offline sessions, 6 SRs, again offline sessions under Professor Matthew Verghese. Next, in 2026 February, next batch will start under Professor Pratap Sharan sir. So after interviewing and selecting the participants of this program, we did some pre-course survey, and I'm going to tell you what are the results of this survey. So we wanted to know how much exposure these residents or the psychiatrists had during their training program. So we asked the questions, in your undergraduate curriculum, do you have any psychotherapy training? And all of them said no, 100% of them said no. And we asked what about in the postgraduate curriculum? 63% said yes, they had the psychotherapy training, and 36% said they didn't have any psychotherapy training at all. And we asked, in your institution, do they come together for the psychotherapy forums frequently to meet, talk about the psychotherapy? And 43% said yes, and 56% said no. And we asked them, do you think that the psychotherapy training in your institution would have been better? For that, 81% said yes. It indicates that they didn't get the training what they were expected. Then we asked them to know exposure after your either residency or when you started private practice, have you attended any course or the training program on psychotherapy? For that, they said yes, we have some previous experience. We attended some online courses or the offline courses. Particularly, they mentioned about workshop by Dr. Salman Akhtar, that is psychoanalytical psychotherapy, and training or motivation interview by Dr. David Miller. We asked them again, say, how much exposure do you have? They said some exposure, they have minimal exposure to this psychotherapy techniques. Then we wanted to know whether the sessions they have done, psychotherapy is supervised or not, how much competent are they in conducting these sessions. So we asked them, have you ever done psychotherapy session independently during your post-graduation? And they said yes, 54%. And all of them, majority was supervised by their professors. Coming to, we want to know the competence, so we asked them, how often you are going to refer your cases to others, either for the lack of expertise or lack of personal in psychotherapy. And 62%, it's nearly 2/3 of them said yes, often we will refer. And we, in our APD and OPD cases, they said in their institutions, nearly 56% of the patients required the psychotherapy training, but still they have to refer to others because of the lack of expertise. Then we wanted to know the cognitive domain, that is knowledge, how much they have on the psychotherapy. And majority of them said, yes, we had only moderately confident in our knowledge about the psychotherapy types or the what specific therapy can use for the patients. And coming to communication skill, that is affective domain in CPME, they said again, moderately I am confident in this communication skill. Then we asked about different aspects of psychotherapy, how much they are confident on a scale of 1 to 5. That is in the aspects of basic understanding of psychotherapy, applying therapeutic principles, managing therapeutic relationship, and managing ethical issues in therapy. In all these aspects, as you can see, majority of them said it's moderately confident in these aspects of psychotherapy. So we asked them, why did you choose this program for, this SPSS program? Majority of them, we need to acquire more skills about psychotherapy, that's why we applied for this program. We asked them what teaching learning method you want to use in this SPSS program. They said, we want hands-on practice or simulation followed by the group discussions, method, case-based group discussions. And again, we asked what techniques they're using as of now or in the past. They said, majority of them said supportive therapy and MET. Very less they said about mindfulness or acceptance commitment therapy or REBT. So we asked, so how we can assess this psychotherapy, any psychotherapy session objectively? They said it's based on patient feedback and the diet satisfaction. So we wanted to know what difficulties they are facing while doing these psychotherapy sessions, and many of them said it's the lack of expertise, time constraints, workload, and burnout in the mental health practitioners. So then we asked what you want to learn or what you want to practice in future, what type of psychotherapy you wanted, and majority of them is cognitive behavioral therapy, and some wanted to try the eclectic therapies, psychodynamic and humanistic therapy approaches. So then we asked again, what are your expectations from this program? The expectation is clearly they want to improve their skills in the psychotherapy. So the one we started the program, the people are little worried about how we are going about the sessions, what we will do in the sessions, all these things. Then we introduce the book, that textbook of psychotherapy by Goldberg, and then we give this assessment form, that is session reporting form. They have to follow this form while doing the psychotherapy sessions, and they have to submit at least one psychotherapy formulation they have to submit to get the completions, and the attendances should be 100%. They can't miss any sessions to get the completion certificate. Then this is one of the reflection from the online sessions. I will read out. That is, dynamic work involves emotions. Patient narrative account has to be explored in a manner which leads to emotional relieving, but in a safe, protected environment. Unlike cognitive therapies, we target emotional catharsis and experiences than cognitive restructuring. Detailed exploration helps in formulating hypotheses which should be tested in the future sessions. Formulations are ever evolving, didactic, preaching. It needs to be avoided. It all has to come through the patient herself. Then this is the Raghuram sir's reflections about one of the case, and during our last session when we were discussing about Sisyphus, one of you had mentioned he must be happy. Further in the reflection, there is something about that. To imagine Sisyphus, the man condemned by the gods to roll a boulder up a mountain for eternity, as happy is to accept one of life's hardest truths. That meaning is not given to us, we make it. Thank you. Now Ishita will talk about her experience.
Okay, so good afternoon. I will talk about my experience as a trainee in this course. So, as we have already discussed, that psychotherapy exposure was largely theoretical during the residency days, and like for us it would be कि अभी वार्ड वर्क के बाद करते हैं, तो OPD खत्म होने के बाद, केस लेने के बाद, and then exams होने के बाद, and then it would never come. In the 3 years of residency, it was very theoretical. Psychiatry practice was mainly pharmacotherapy driven. So I personally felt very underconfident when patients would come to me and ask for psychotherapy. मुझे counseling चाहिए, मतलब medicines की ज़रूरत है क्या, सिर्फ counseling से नहीं होगा क्या, and that would make me very underconfident. Like I would prefer to refer them to a psychologist because I was not confident in that. And also for dissociative disorders patients, we know that psychotherapy is the main therapy also. But then I was not confident in giving that also. So there was a felt gap between the theory and the practical skills. So this thing that there was a gap between theory and practical skills, this was also common for the 5 scholars in our batch. So what could be the various reasons? We just thought about that. What could be the reasons that psychotherapy training is inadequate during residency? So we felt that it is not because of lack of interest, but maybe other factors like heavy workload is there, time constraints are there. Faculty has multiple other roles like administrative role, clinical, academics, and also lack of trained faculty is there. And one more important thing which we thought was that medicines lead to faster response, and psychotherapy response time is also more. So people tend to rely more on medicines, and also lack of structured longitudinal supervision model. So these were the various reasons which could have led to decreased training during residency. Then why this IToP SPSS program? So this IToP SPSS program gave us a structured opportunity to develop the skills, and we were only 5 scholars in the batch and 1 supervisor, Becky was there. So and every participant was given equal chance to discuss his or her perspective, and sir would invite everyone to share his views about the case being discussed. So their interaction was very intense, focused and meaningful, and because of the small group we had deeper reflection and better insights. So one more thing, this in this forum was like that we have to discuss cases which we are actually we have taken up for the psychotherapy in our clinical practice. We have to discuss like what is the problem we are facing, how to go about, how to go further, are we facing any resistance. So all those practical things were discussed in the forum. And so emphasis was on reflection and progressive skill building. So a few things about what we learned. The first thing was psychodynamic formulation. So that was understanding a patient's beyond his or her symptoms, like understanding him or him on the basis of unconscious conflicts, what defenses he is using. Then as like initial symptoms and category, ये diagnostic criteria fit हो गया, ये है. But then after this it was like what the defenses could be, why he is experiencing this type of symptoms, what was the emotional distress. So that was a very new learning for us. Then another thing was the trans-diagnostic application. Initially, till before this course, it was like OCD hai, to ERP mostly that comes to the mind. But then one of the cases of OCD was discussed, and then Matthew sir said that ऐसा नहीं है कि OCD है तो ERP. You can do the psychodynamic psychotherapy also. It's not the disorder-wise therapy is fixed. You can take up any patient for any type of therapy, provided he meets certain other requirements that is common, like psychological mindedness hai ya nahi, that you have to see. And if it is there, even OCD patient you can take for psychodynamic psychotherapy. So that was again a different learning for us. Ki acha OCD, sir said ERP is a behavioral technique, ठीक है, but psychodynamic also can be done. So that was again a new learning. Then coming to special clinical focus areas like dissociative disorders, as I mentioned, I was very underconfident, so that helped. These courses helped in understanding how to deal with that. So use of transference as a tool, and then facilitating emotional ventilation helped in dissociative patients. And another new learning was that flashbacks, which we often think that it is pathological. Like if a person is having flashback in PTSD, it is very problematic or distressing for him. But in one of the cases which was discussed, sir said that in that case flashback was actually protecting the person, and it's not always pathological. So then again it was a very different learning for us. And the last important thing which we learned was how to read a patient's behavior. Patient slams the door, so it's not just he's slamming the door. It may be some silent aggression towards us. Or if the patient is bringing gift, what would be the reason for that? Then patient comes late for the session or misses the session, what could it mean? So it was basically not what happened, to basically what does it mean. So that also became clear. Now how are we learning this? Was like one of us mostly like it is 60 to 90 minute sessions, and one scholar presents a case he has actually taken up. We discuss the whatever problems we had. Suppose if we have already presented a case earlier and now we have taken up some follow-up sessions, so we can present those follow-up sessions also. And sir will guide like, okay, this was okay, this was not, this would have been a better way. So that reflections is there from the supervisor. And also the theoretical thing is like some resources have been shared about the books and the articles which we need to go through, that we have to go through on our own and then accordingly practice, and then we can discuss whatever problems we have in the sessions. Then how is learning evaluated? One is the pre-survey, which Dr. Murali just discussed. So pre and post surveys. Then the supervisor has qualitative data about how learning has been over time. And also we have to submit one case completely worked up for psychotherapy with the session-wise format which was shared by Dr. Murali. So coming to the experience, definitely this course has increased the confidence in the psychotherapy cases, and now at least initially I would become very afraid and fearful of how this patient is asking for psychotherapy, I should refer to psychologist. But now that fear has reduced, significantly it has reduced, And also, though as it's not that I have become a master, but skills are still evolving, framework is clear, so much better than what I was before. And the felt need for continued supervision. This is like psychotherapy, as we know, is a skill and it will continue to improve over time with continued supervision. So as a group, we felt a strong need for ongoing supervision beyond these 6 months and 12 sessions for sustained skill development. So this was a gentle request from our side to the IToP platform. And online versus offline training, as you know, that online has some advantages for, like in our batch of 5 scholars, we are from different places. We have one from Kalyani, Patna, then Delhi, then Lucknow, and then Mangalore. So different places are there. So one faculty from Bangalore is able to train 5 people from all over the country. So that is important in areas which lack local expert faculty. Offline sessions can be can take place when experts are available in that area, or some models can also use hybrid approach. So looking forward, as you know, the psychotherapy is a skill and it will improve with continued supervision, and to train the residents, like the deficiency which we had in our residency days, we would like to cover that deficiency for the residents. So what we can do, once we acquire certain level of skills, we can act as supervisors for future courses which IToPs plan for residents, the postgraduate residents, and that would increase the number of people being trained in psychotherapy. So IToP SPSS would be a scalable faculty development model. Thank you, that was from my side.
So the last part of the discussion was by Professor Murali, who wanted to say what is that we should do about psychotherapy training, what is the road ahead, but he could not say come, but he has sent his message. The first is that we want to evaluate robustly by an external member about what kind of psychotherapy training is currently happening. So 16 people are now getting trained, but we have put a person who is not a supervisor, not a trainee, to see whether it actually is doing what it intends to do. So we have one external member evaluating the thing. A second is that to enhance the more supervisor, we want to rope up with the Royal College of Psychiatry as well as the psychiatrists who are keen in psychotherapy across India, specifically for what people are requesting, like CBT and MET and other formats of thing. I think Dr. Vikram Patel also emphasized that if we give up on the psychotherapists, we will lose the hold on the mental health across the thing. Third aspect is that, as Nitisha was saying, these 16 people across India who are being trained, will they be able to give supervised sessions for postgraduates under them, especially those who are coming from low resource center where there are not enough psychiatry faculty who are interested. So for example, if Dr. Nitisha can take up after she completes 4 or 5 and helps them for next 6 months. So that is one model we have in mind. But we should also give some rewards to the psychiatry teachers who are trying to do something in psychotherapy. And one of the awards which we have come out with is the IToP award, which gives early career psychiatrists an edge to try some training for the postgraduate, and that can be showcased so that other institutions, other regions can use it. Fourth is periodic CMEs on psychotherapy. There is one very nice CME on psychotherapy coming in Vaidehi Medical College in Bangalore on 13th and 14th of February. They have brought nearly 2 days of extensive program on many aspects of psychotherapy, and whether we can do the way we did for the first time in Indian history, exclusive conference on psychotherapy in Indian medical colleges was held in AIIMS Bhopal. We are thinking whether we should have the 2026 conference in PGI under Swapnajit Sahu. That is in pipeline we have in mind. At the end, we want to bring back psychotherapy training to the medical colleges in India, particularly for psychiatry residency, whether they are taking DNB, DPM, MD, DM or PDF, that psychotherapy should become part of the training. This is one of the intention. With this, we conclude and hand over to the chairperson. I think we are well ahead of time. It is 1:42 now. So we started late and we ended early. But the hall where there are only 4 chairs, now it is full. So over to the chairperson. Thank you so much.